Welcome to Psychologist Talks. This is going to be the fourth episode in a series about depressive personality disorder, and this episode is all about treatment. Now, with all of my episodes, but especially those about treatment, remember that this does not constitute medical advice. So if you are a potential consumer in the field of mental health, do not replace this with, actually seeing a provider. And just as well, if you're a provider, while this is hopefully helpful food for thought, this does not replace supervision or consultation or training. So bear that in mind. As far as the content goes, these vary a little bit depending on the personality disorder that I'm talking about. But in this particular one, I'm going to focus predominantly on the primary three. Number one, framing. Number two, really what are the goals of treatment? And number three, countertransference. Although I think I just did that in the wrong order. I think framing first, countertransference second, and then, hey, what the heck are you doing is number three. So yeah, let's get to it. So framing, if you haven't picked this up by now, if you've listened to enough of my stuff or watched enough of my episodes, I love framing. Framing to me is the most essential thing that we do in our line of work. It's something that I have kind of expanded upon because of a relational psychodynamic approach, but it is particularly important with personality disorder work. So when I'm training folks, I often say heck, if you don't want to frame with most of your clients, okay, fine. If there's not like a screaming personality issue in front of your face, you might luck out 50% of the time or more. But if you know or have a strong suspicion that you could be working with a personality issue, framing is one of your best friends. And that continues to be the case with depressive personality disorder, even though they are some of the easiest to work with. Or if I pat myself on the back, I would be the easiest person. There you go. If you haven't watched or seen my prior episode, I self-disclosed yeah, that's me. I'm a depressive personality. But again, there's a reason. So remember, framing is just this idea of hey, what expectations do we have of one another? How do we set an intentional frame, or using different language, how do we set an intentional foundation upon which we might build this house? For depressive personality disorder, the issue is not whether or not they're going to be collaborative and introspective and those sorts of things. They tend to be thinkers. They tend to reflect quite a bit. What you're trying to encourage, much like I would argue with dependent personality disorder as well, is to say I need your feedback. I need you to share when you have less than savory feelings, especially about me or our work together or anything like that. Now, the reason why you set the stage for this is because they tend to, due to their kind of wallowing nature, they tend to be very depressively inclined, something's wrong with me, or something's going to be wrong with my relationships. They will tell you all the things that aren't going well, and they will often stay stuck in that place. And what you as a provider are often trying to do is solicit other self states, particularly around frustration and anger and resentment and other things that I promise you are brewing underneath the surface, but are usually disallowed and disavowed. It's something that they cannot possibly do or offer because it's just kind of too dangerous. It would compromise this notion that I am somehow the worst thing ever, or it would compromise their relationships if, someone was going to leave them if they would actually express anger. And that's where there's a little bit of an overlap potentially with dependency. So you really have to invite and say no, for real. I mean, I'm going to disappoint you. I'm going to say things that might not always land terribly well. I might say some things that might sound particularly harsh. And just because, you assume that I have your best interest at heart does not mean that you won't be frustrated. Does not mean that I don't need to hear from you that, hey, something was particularly frustrating. So, not only is that essential for any good therapeutic relationship, it is essential for their growth, which then overlaps with number two, common countertransference. Now, providers tend to really as I was mentioning earlier, they tend to really like depressive personality disorder patients, particularly the higher functioning ones, the neurotic ones, because they're very nimble folks. They tend to take a lot of personal accountability. They are actively seeking help. They know that they need help. And so they're quote unquote good patients. They're just easy to work with. They're not yelling at you. They're not upset. They're not entitled. They're not... the worst case scenario is if they're, although this is less on the neurotic side and more as you get towards the really serious side, is they're hard to activate and they can have really depressed days where they might cancel or something like that if they're in really the deep throes of depression because they're in some too big of a crisis to come in and bother you. Oh no, bother you, the provider. But yeah, all in all, we tend to like these patients. Now, as the relationship grows, it does change a little bit depending on the individual. I've supervised enough folks to run into those who get really frustrated at depressed patients because they just do not want to get into an action phase of treatment. Let's kind of get to where we're ending here, but they're just really resistant to change. They tend to wallow and stay entrenched in their depressivity, which begins to frustrate providers to varying degrees. Again, the ones who are more action oriented and want people to take personal responsibility and accountability and move towards something right away, they really find themselves frustrated, I think, quickly with these folks. Those of us who are fine with keeping into a holding environment and sort of observational work for a good amount of time, there can be a kind of lingering or growing frustration over time. But even then, that frustration does not often get to be too much because it's not like they're disinvested in treatment. It's just that they don't tend to make progress, and so we can end up holding them for a long, long period of time. And so what the greater challenge is in the world of countertransference is holding them to count and not handling them with kid gloves, because that's part of the enactment is their defenses tend to solicit a response that validates the fear that they are weak and ineffectual and need to be held and supported at all costs because something's wrong with them, or they won't be successful in relationships. And so you inadvertently can become this omnipotent power in their life that they're clinging desperately to, and they will stay in kind of a sick role for a long time. Like they will stay unwell, and they will kind of compulsively come back to their weakness and their frailty, and you just keep supporting and supporting and supporting. Well, they're not going to get better. Eventually, you again have to push them towards anger, push them towards assertiveness, etc., etc. And so you have to resist that urge or temptation. Now, there's not really like a timeline for that. In my experience, like I feel like working with a depressive personality, even like a neurotic level, is multi-year work. I mean, that's the case for most personality disorders in general. Maybe you can get it to 6 months to a year with a really high functioning depressive personality, but by and large, this is longitudinal work. So if you're not pressing, I would argue at least a little by year one, if not pretty substantially by year two. Again, this is an anecdote. It's not like in a book or research anywhere. I would argue like you need to reevaluate things and start pushing a little bit heavier. Why? Well, let's get to the final point, is what the hell are we trying to do in work with depressive personality? Well, it depends on, if you haven't listened to my Ground, Observe, Act, the Change Over Time episode, that's the theory that I've kind of come up with. I'm realizing I should probably just take ownership. It's something I've come up with, borrowing from lots of smart people, but it is my own model. Depends, like grounding, observing, and acting. As I've already said, they're really not great at action, whether it's because they're too afraid to realize how bad they are, or they've had some legitimate and some imagined bad experiences that pushes them away from action. So they tend not to be in the action phase unless they're pretty high functioning neurotic level. So normally you're getting them in a grounding phase and or an observational phase. And I would probably bargain most of the work is in the observational phase. Why? Well, they're usually quite grounded-ish. So I'll kind of say what I mean. The challenge with depression is there's a hyper-realism about it. They're constantly analyzing their environment for any potential flaw, and some of those flaws do have kernels of truth to it, and then they just kind of overextend it. And in that way, they're kind of too grounded in their depressive emotions, and grounding actually becomes a little bit of a different work of catching them and saying, like, well, hold on, you're like, it's like you're so grounded, you're like you've buried yourself. Like we gotta get you back to like the surface level where there's oxygen besides depression. And so the grounding, I think, is like kind of calling them out and saying like, well, no, I need to hear about and I need you to search for other emotions besides the sort of more depressive energy. again, it's not that they aren't already self introspecting. It's just kind of fine tuning the introspection to look for a little bit more and not see the world through this singular lens, because that's what's influencing the observation phase so much. So you're trying to say, like, hey, I need you to be more grounded in where you're at and notice that there's probably more ebbs and flows than you are realizing. The only other caveat, though, is some of them aren't terribly grounded because they kind of dissociate from life. They go through an autopilot because all these painful thoughts and affects are a lot for them to manage, so they just drift. This is particularly true if they've been depressed for years and years and years. You're meeting them later in life. You might actually have to get them grounding a little bit more in what's coming up. And one of the challenges in that particular phase of treatment, in my opinion, for folks with depressive personality, is you're asking them to become more aware of what is likely to be painful emotions and painful memories and thoughts. But they have to be able to tolerate that distress and actually be with that to, again, be in workable space for the observation phase. So again, most people, in my experience, you don't necessarily have to ground them to be more in tune per se. You're actually looking for more attunement to more emotions than the black, or the blue, I guess, if you're going with depression. But there are those that are so kind of overwhelmed with life, usually having comorbid issues, not just depression, that you're actually needing them to become more in touch with emotions, even if that includes painful realities that they need to work through and confront. I will say the latter of those cases are multi-year work in my experience. You're really kind of getting them to feel sufficiently safe to ground, and the observational phase in and of itself is really long. Usually there's traumas and stuff like that when it's that bad, right? So, or just lots of adversity, et cetera, entrenchment in their depression for many years. So the observational phase is, to me, where the bulk of the work goes. Now, this is where CBT people can have a little bit of success, because what they're trying to do is say, like, well, all right, sure, you have, these negative cognitions. Can you counterbalance them with other cognitions? Sure. The problem, though, is if you're just replacing thoughts or kind of like shoving in these quote unquote positive thoughts, you're not really transforming their fundamental beliefs. I mean, you really have to tend to underlying self states and get them to observe themselves and actually relate to people in a way, not relate to people, get them to realize that people relate to them in ways besides negative, that they're flawed in some sort of fundamental way. The challenge with this phase is that often they're not going to get better if they don't engage in action. My relational psychodynamic approach suggests that really the healing has to come through relationships, and the therapeutic relationship is one of them, but it cannot be restricted to the therapeutic relationship. At some point, they have to go back out there, take more chances, and understand that they can be appreciated and seen and experienced in ways beyond the sort of badness that they have internalized pretty much for most of their lives, beginning at usually a pretty young age, if not the teenage years, young adulthood at the latest. So again, this is in brief. Grounding is usually relatively intact, but you sometimes need to get them to retune or become more grounded in all of their emotions. The observational phase is trying to hold dialectics, that there are kernels of truth to their depression, but there are other ways of seeing the world as well, and there are other ways to see oneself. And then eventually you've got to kind of shoving them gently into more action-oriented phases, so they can go out and have experiences that contradict these depressive assumptions, especially those who've been entrenched for multiple years. They often they're so, they have such a perverse relationship with positive experiences. Just getting out at all and having experiences can be a big deal for them. What's really important through all of this, I say this, I think I said this in the dependent personality disorder section, is there is a little bit of reliance upon you in this process, but developmentally, what you're aiming for as they get closer and closer to action is, because they have a secure and safe attachment with you, there's a healing process that's happening with you if you are practicing more of a relational psychodynamic approach and really reflecting to them your experience of them both the positive and the not so positive, they're coming to check in with you, and there's an increased independence. If they are constantly checking and they're afraid and they need constant reassurance from you, then you have to be careful, because the transition to action phase could be less about them truly exploring their self independent of you, the safety net, and more of just making sure that they're the good patient at that point. They're doing it because you told them to, and they would be weak, frail, and ineffectual if you were not there pushing them the whole way. So something to kind of keep in mind. So that's it. I mean, a bit of a short episode, but again, I don't like to go too in depth or in detail, because it's about treatment and it's free content as well. But to me, it's like, if I had to use some sort of metaphor or imagery for it, it's kind of like depressive personality disorder, particularly the longer that they've been kind of stuck in their experience. It's almost like they're adrift in outer space, right? There's no solid ground underneath their feet, or if there is any, it looks very distant to them. It doesn't feel very hopeful to them. And when they come to you, and you don't just immediately shove them into action work or coping focus work, and to me, I think traditional CBT is not their best friend. Components of CBT are useful, but it needs more than that. You're basically a relational tether, right? You, the provider, are kind of the astronaut. You've got the suit, you've got the tank, you've got a tether back to at least the space station, if not a way to get back to Earth. And you reach out to them and find them, but you don't pull them back to safety right away. They will resist you if you try to pull them back to safety right away. And so really you're just being with them in outer space. And you're just seeing things for as they are, and you don't fight them tooth and nail. You offer kind of alternative perspectives and kind of gently, soften their experience, but you don't invalidate them and say, well, you just need to look on the positive side. You have to be with them out there in outer space and just let them, just be with them while they're adrift. Eventually, when you prove to them that you're a stable relationship, which they will not tell you, right? They'll glom onto you right away, but they're not really trusting that you really see them, right? The real them. But when they're willing to kind of join you, then you kind of hold each other and say, okay, so I'm going to teach you how to navigate space, right? Maybe they've got a old booster pack that, they could blow air. I don't know how this works in space, rocket them forward or whatever. You refill that tank for them or whatever. And you kind of drift around and be like, all right, come on, let's go back to the ship together. But you don't just yank them again. You're just like, well, let's try. But inevitably they will try and it won't go so well, or it'll go well, but they default back to, and like, I don't know, it's just too far, and they start drifting. And then you pause with them and you go, yeah, I know it's tough. I'm right here with you. It's okay. It's all right. And they're like, yeah, it's okay. And you're like, so you want to try again? Do you want to kind of keep going? And you just iteratively do that. You just kind of gradually do that. And eventually, you're doing really good work when they start doing it on their own. And they're like, that was tough, but I think I want to try again next time. You're like, oh. Or something didn't go so well, and they're like, yeah, but you know what? That wasn't my fault. That was kind of dumb anyway. You're like, oh. You're like, yes. It's like there's more than just depression. And eventually they're coming back to the space station. You're finding a way collaboratively to get back to Earth. But again, you are not shoving them in that direction. You join them, you're with them, you collaborate, and then eventually you're kind of both moving together, and eventually they're moving on their own. And it's really rewarding work. I as much as I've not fully healed myself, but I guess that'd be a final note. Is it's like your job is not to be a panacea, a cure-all. Your job is not to like absolve people from the depressive experiences. Your job is to help them coexist with them when they inevitably recur, because they'll be back. I said it in the last episode, 7 out of 10 times, right? I'm doing pretty good 7 out of 10, but I've been able to buffer against that, right? I'm not in outer space anymore. Worst case, I'm in a space station. I'm not quite on solid ground, but I know how to operate there, and I don't find myself so readily adrift again. Or if I do, I have loved ones and friends and other people who kind of keep me in check and pull me back, or I just know how to weather it quicker because I've weathered it enough times before. That's like, no, I don't need to give up all hope. I'll drift a little bit, but I can, get right back on this and find my way back to a better place of being. So anyway, I think that's it. Yeah. So I got to figure out if I have another one. Normally I do an episode, I think, on gender. I don't know if there's really need to do that because, the long and the short of it is I don't know if there really any gender difference. I'll have to double check, but it's depression, right? Just chronic depression. Maybe there's a difference in who's more likely to report it and come in for treatment. Spoiler alert, usually women, but I'll double check and then see if there's anything else that might be worthwhile. So this could be the last episode. If so, thanks for tuning into the series. If not, look for the next one. But yeah, as always, stay curious.